It's time to imagine better health with CHI Health. Our focus today is a liver-threatening disease, hepatitis C. It's a viral infection that rarely has symptoms.
So how do you know if you have it? It often comes down to a one-time test.
Here to explain who should get that test, Dr. Sandeep Mukherjee. Good to see you. He's a CHI Health hepatologist. Thanks for stopping in, Doctor.
It's nice to meet you.
Let's talk about some of the numbers here because we really don't know what the estimates are out there. How many Americans does it affect?
Well, it's estimated maybe between 3 to 4 million Americans have chronic hepatitis C, and maybe half of them don't know they have the virus.
I was reading about baby boomers and how they account for a large portion of patients. Why is that? What is it about that age range?
Well, no one knows for sure, but basically those Americans born between 1945 and 1965 are felt to be the highest risk group for having hepatitis C. And those guidelines have changed significantly over the last 10 years. Now, why are those people or patients at risk? It's not really clear. It might be because they received blood transfusions before screening was started. Was there a history of accidental injection drug use? So it's not really quite clear. But one of the things we know is 70% of Americans are felt to be within that that group.
70%. So who should get that blood test? Because there's a blood test that can check for hepatitis C.
Yeah, and it's very, very straightforward. I mean, you basically go and see your primary care doctor or practitioner. And if you're born between 1945 and 1965, it's recommended that everyone should have a one-time blood test to check for hepatitis C.
This antibody test, it's not routinely done. I mean, I don't know that you go in for your annual physical and it's always recommended. So a lot of people might not even know it exists.
That's correct. So previously, patients who were at high risk, for example, those who are known to have a history of injection drug use, and other high-risk groups, they were the ones who were targeted, but screening really didn't work in those patients for a variety of reasons. However, for those patients, again, born between 45 and 1965, when you see your primary care practitioner and you're talking about screening mammograms or colonoscopies, that's also when a discussion should be held about hepatitis C screening if you're born between those years.
Yeah, but there's people out there that say, listen, maybe I've had hepatitis C for many years. What I don't know is not going to kill me. Maybe they bury their head in the sand, but there are other symptoms, other causes, other things that can come out of hepatitis C. What are they? What are the health implications of not taking care of it?
Well, one of the concerns with chronic hepatitis C is it can lead to cirrhosis, and patients may not have any symptoms until their liver disease is very advanced. So by the time you, say, get yellowness of the eyes called jaundice and other complications of cirrhosis, it may be even too late to treat these patients. Recently, we've also noticed that patients who are treated and cured from hepatitis C may also have an improvement in their overall survival. So hepatitis C treatment may not only improve complications from liver disease, but also improve all-cause mortality as well.
On the CHI Health website, this is the hepatology page, and you, speaking specifically about liver disorders, will show you the website so you can get to this page if you'd like to learn more about it and watch those videos. But the good news here, some of the new medications that are available to patients. Where's the promise right now, and what kind of difference are those meds making?
Well, the new medications have been a breakthrough in the treatment of hepatitis C. This is something which I've never seen before in medicine. It's basically transformed the management of hepatitis C from what was a previously very difficult, ineffective therapy which caused lots of side effects and required injections, to now administering pills which are very, very well tolerated, which have very few side effects, and which can cure maybe 90 to 95% of patients.
Wow, that's incredible. So the types of improvements that these patients are seeing, dive into that a little bit. How does it affect that?
In terms of curing these patients.
Yeah.
I mean, let me put it this way. A lot of patients who take these new medications for hepatitis C don't think the drugs are working because they don't have any symptoms. So that's how effective it is.
Right.
And when we treat these patients, we still follow them as closely as we did with our previous patients. But we've seen very, very good results in practice, which almost reflects the excellent results which were seen in the clinical trials. So
We'll wrap up the conversation there with treatment, but then we started the conversation with that test. So you said the years again, if you were born between
1945
and
1965.
You're kind of in that zone where that's where the majority of hepatitis C cases are seen. So we encourage you to call 402-449-4692 if you'd like to learn more about CHI Health's hepatology department. And then ask your doctor too just about that test so you know for sure how you're doing, even if you don't have the symptoms, because you very well won't.
That's the bottom line. Get that test
Yeah.
if you're in that group.
Thank
Doctor,
you.
thanks for stopping in this morning.
Nice to meet you.
Thank you very much.
Thank you.